How effective and efficient is the practice per department overall? How do we know that when we walk into a practice that we're potentially going to buy or that we're trying to turn around and fix? Well, we use a couple of these audit forms to do that. Are teams' self-assessments accurate and consistent with reality? Okay, you'll understand what that means here in a second. This audit form, practice core competency, is an audit form. This audit form is to be completed by each member of the team as well as the owner of the dental practice. The results are tallied and the team's responses are compared to the doctor's responses. All areas scored low are identified and prioritized. Okay, I think this is in the back of your book as well. It's in forms behind all the slides. I'm going to try to read this off of here. So this is our practice core competency form. I will not take credit for this. We have a really awesome member of our mastermind named Ryan Koenig. He has a multiple $million practice in Denver, Colorado, about to have 2. He is one smart cookie, and our mastermind borrowed this core competency form from him. Okay? So let me see here. It's right here. It's form number 1 in the back. Okay. So, team member, their position. Here's how it works. The weights. Each line item in section is assigned a percentage based on the importance for that job. All lines in the section should add up to 100%. So your team members are going to fill out these rating forms, and they are going to rate how important they think that line item is. Okay, so let's do this together. Clearly, I only have the first page. We have several pages on each one for each department. This is just a sample. Okay, so they're going to weight it, right? Commitment to excellence in patient care. Sally, what percentage out of 100 do you think commitment to excellence in patient care is? Well, doctor, I think that there's a lot of important things, but I think that should have a weight of 50%. Okay, so put 50% right there. Now, on a scale of 1 to 5, how well do you think we are doing that as an office? Well, I think we're really good at that. I'll give that a 5. Then you multiply the weight times the rating, and you'll get a score. When you add all these up, you're going to get a score out of 100. Areas where you think, or where that particular team member thinks we're weak, and when the weight is high, those are the areas that you want to focus on. Does that make sense? So you're getting a weighted idea of how that particular employee feels about the practice in several different areas. We have foundational principles, we have job proficiency, we have clinical ability, we have all different types of categories. Does that make sense? Okay, it's just a good way for us to get an idea of how they feel the practice is going. Okay, next. Departmental assessment forms. These forms are departmentally specific self-assessments and are to be completed by each team member and audited by the owner and management team. We do not semi-annual, not quarterly, we do monthly reviews with everybody in our practices, monthly reviews. And our reviews are different. In our reviews, the staff member has the opportunity to review how well the doctor is doing in certain areas like communication and patient rapport and clinical ability. And the doctor and the CEO and the office manager has the ability to rate the employee on a scale of 1 to 5 in certain number of different areas as well. So when you're doing a review on a monthly basis, and they are rating you and giving you their honest feedback, and you have to make sure that they know they're in a safe place, and they're free to speak their mind and rate you based on their honest opinion, and you are rating them on a scale of 1 to 5, you get a lot of valuable information. You save yourself a lot of drama. The lines of communication are open greatly. Slick. Okay, these forms serve as a barometer for how each team member feels they are performing in areas that are most important to the owner and management team. These assessments can be used during periodic employee reviews. Okay, so if you look here, Form 2, let's read through here. And by reading these self-assessment forms, you guys will get a very, very good idea of what our core values are because they're built into the self-assessment form. So let's read through this together, and then we're going to get close to wrapping it up here, okay? Okay, this is for back office, dental assistant. I greet patients warmly in the reception area according to the standardized protocol and script. 1 to 5. I seat the patient, adjust the headrest to comfort, and then don the patient napkin. 1 to 5. I ask 3 non-dentally related questions and record and date the responses in our office and designated area. 1 to 5. I pass on any patient milestones to the front desk for special occasion cards. 1 to 5. I verify treatment that will be performed, take blood pressure, and record that in the chart notes immediately. Score of 1 to 5. I verify all appropriate equipment, materials, instruments are set up according to standardized protocol. We have an office manual, an operations manual. We have pictures. We have protocol. You're asking them how well they are doing according to their job description. If this happens every single month, and they're consistently giving themselves 5, but you think they get a 1, we have a problem. Their perception and reality is 2 different things. So we need to discuss with them why perhaps they're not a 5 and more like a 1. And then we slowly get them in each of these line items up to a 5. Can you see the value in doing this every 30 days? So you start to manage out undesirable behavior and encourage desired behavior based on what they're telling you about what they do every single day on the job. Valuable? Great way to manage non-confrontationally